Hello, my name is Mary Ann Curry. I'm the Clinical Services Director for Bupa Australia. My role is to look after the residents and the staff in our aged care homes. I'd like to speak with you today about how we are managing the prevention of infection into our homes. A few months ago, as the pandemic was emerging and evolving, we built an outbreak management plan, and there are elements of that plan which you would have experienced when you visit our homes. There are things like the screening protocols that we've put in place. So we've asked you questions about where you've been, we've taken your temperature, and we've made sure that you are well before you enter the home. One of the elements of the plan that we have, and there are a number of elements in the plan, one of those is the opening and closing of homes at relatively short notice. So you may well have experienced this yourself. The reason we do that is we are very, very closely monitoring the transmission pathway in the community that the home is in. There are a number of other measures that we've put in place, and that is to break the cycle of transmission or limit that cycle of transmission from the community into our homes. We understand that having all of these restrictions in place makes it extremely difficult at times for you to make contact and have contact with your family member. It does mean that there will be times where it will be difficult for you to see them. Where we can have access, we will ensure that access occurs. In particular for residents who are at the very end stages of their lives and who are palliating, those residents who are in great distress. We understand that it is just as distressing for you as it is for the residents in our care. You may have questions around how we are preventing or limiting the exposure of our staff to COVID, and in turn limiting the exposure to our residents. It's really important that our staff coming to work are safe to come to work. So if they are at all unwell, or if they reach a particular temperature threshold, we ask them to go home and they do not start their shift. We are rostering staff to communities, so they will predominantly work in a particular community. And what that means is, if there is a staff member who is exposed to COVID through their community, through perhaps a member of their family that they live with, we can very quickly trace the steps of that staff member, what area of the home they have worked in, and who they've directly come into contact with. Now, this is critically important if the staff member themselves tests positive. Now, we have asked those staff in particular who catch public transport to not wear their uniforms to work. That is because I consider the inside of our care homes to be a COVID-free, clean environment. And there is a risk that is associated with catching the bus or the train or the tram. So we've asked our staff, don't wear your uniforms if you're catching public transport, but get changed into your uniform when you come to work. So when they step into a clean environment, they are in a clean uniform that hasn't been exposed to the general community. When we have a possibility of a COVID positive staff member or resident, the decisions we make have to occur within a very, very short period of time. Now, these decisions are made in order to keep everyone as safe as possible. Every hour counts. It is that critical that once we are aware of a COVID positive case, that we move rapidly and we move with decision and at pace. And that is what we will continue to do. Hopefully you can appreciate that there are a number of factors that play into our decision making every single day. What sits at the heart of what we do and the decisions that we make is the health and the safety of our residents and our staff. We do ask for your patience when we make these changes, when we perhaps restrict visits with relatively short notice, then we open the doors up to visits again. I hope that you can appreciate that we are making these decisions based on information around us, around what is going on in the community. It's based on government advice, it's based on state advice as well as Commonwealth advice. But we must keep our residents safe, and we must keep this virus out of our homes for as long as we can.